Mr. Speaker, we've been called back to the Legislature by this tired and out-of-touch government. But they haven't brought us back to deal with the issues that matter most to Saskatchewan people: the cost of living, health care, the state of our kids' classrooms. They're not focused on what matters most to people. Instead, we see them using the notwithstanding clause to knowingly do irreparable harm to already vulnerable kids. The question is this, Mr. Speaker: how is that leadership, and whose rights are they coming after next?
Hear, hear.
Recognize the Premier.
Hear, hear. Speaker, most certainly. This is a government that is investing not only in health care. Mr. Speaker, as recently as last Friday, announced an update to our mental health and addictions action plan here in the province, Mr. Speaker, on behalf of Saskatchewan residents that we all serve. We're building new schools, Mr. Speaker. I've been to a number of announcements of new schools, Mr. Speaker, and we continue to invest in the very operations of our education system, Mr. Speaker, investing in more teachers, more educational assistants, and ultimately, Mr. Speaker, in a stronger education system for our children in the province. Mr. Speaker, when it comes to policy, Mr. Speaker, this government also most certainly supports parents having the opportunity to be involved in their child's school, in their child's classroom, and ultimately in their child's education, Mr. Speaker. And so the question here today, Mr. Speaker, is why do the NDP not believe that parents should be involved in their children's education?
Recognize the Leader of the Opposition.
Mr. Speaker, the Premier is spewing nonsense and has clearly lost the plot. Saskatchewan people right now are struggling with the cost of living more than any other province in the country. We have the highest rate of mortgages in arrears, and families are paying $1,608 more in utilities and taxes directly because of decisions from that government. The Premier, we see him offering no cost of living relief, only more costs, Mr. Speaker, and more division. How did this Premier become so out of touch with the realities of Saskatchewan people?
Recognize the Premier.
Hear, hear. Mr. Speaker, with respect to the investment in our communities, which I just covered at a very high level a moment ago, Mr. Speaker, with respect to this government supporting parental inclusion in their child's education, Mr. Speaker, in their child's classroom, Mr. Speaker, this is a government that has continuously and annually invested about $2 billion or better, Mr. Speaker, in affordability measures in the province, which have been well covered on the floor of this legislature over years gone by. Measures, Mr. Speaker, I would say that first and foremost include, when you do a tax comparison, how much a family of four in this province is paying in provincial income tax and PST, Mr. Speaker, from today back to 16 years ago when we had the honour to form government, Mr. Speaker. That family of four with a household income of $50,000, they're paying $2,499 less dollars today in tax than they did in 2007. If that same family of four finds their fortunes to be $100,000 in annual household income, Mr. Speaker, they still would remain paying $2,443 less dollars each and every year, Mr. Speaker, in provincial income tax and PST than they did under the members opposite.
Recognize the Leader of the Opposition.
Mr. Speaker, we recently had some by-elections in Northeast Regina, and the voters in those by-elections sent this government a clear message. He's failing on the cost of living, failing on health care, and Mr. Speaker, he's clearly tired and out of touch. They're not listening. There's nothing new from this Premier to fix the crisis in our healthcare system. We see nothing to fix the chronic understaffing in our healthcare system, leaving ERs closed, and nothing to address the longest in Canada wait times for knee and hip surgery. Why is this Premier instead using the notwithstanding clause against kids, instead of acting now to fix what is a broken healthcare system?
Recognize the Premier.
Mr. Speaker, with respect to the legislation ultimately that will be introduced, Mr. Speaker, and not withstood, Mr. Speaker, that's about preserving the right for parents to be involved in their child's education, something that the NDP can now explain to parents as to why they do not support that parental inclusion in their children's education. When it comes, Mr. Speaker, to investment in health care, Mr. Speaker, unprecedented investment in healthcare, up to and including commitments that are on the floor of this legislature, Mr. Speaker, and across this province, Mr. Speaker. Significant investments in the most ambitious health human resource plan in the nation of Canada, Mr. Speaker, that is landing additional nurses, health professionals in each of our communities, Mr. Speaker. The incentives that are being provided to ensure that those individuals are arriving in the positions where they are most needed, Mr. Speaker. We're seeing investment in new and innovative ways to offer services to Saskatchewan residents, like urgent care centres, one being built on North Albert here in Regina, one being built in partnership with the Takakoop First Nation in Saskatoon, Mr. Speaker, offering not only urgent care, but mental health care, Mr. Speaker, and addictions services, Mr. Speaker, leading to that single point of access, meeting people where they need ultimately their care, Mr. Speaker. We are doing a record number of surgeries in this province, both all publicly funded surgeries, some in our public surgery centres and some in private surgery centres, Mr. Speaker, all funded by the public, by the province of Saskatchewan, Mr. Speaker. What you can look to see in the future from this government, Mr. Speaker, is more investment in healthcare capital, more investment in healthcare services, and more investment in the actual individuals, Mr. Speaker, that are offering those healthcare services in community after community across the province of Saskatchewan.
Recognize the Leader of the Opposition.
Mr. Speaker, with all the bluster from that Premier, you'd think that everything is just fine with our healthcare system. Right. But here's the thing. This summer, we learned that in Saskatchewan, we had the largest drop in life expectancy of all the provinces. Put clearly, under that Premier's watch, Saskatchewan people are living shorter lives and they're dying sooner. The question is, where is the emergency action to fix that?